It's again, thank you for the opportunity to get to say a few words on. Again, I feel strange using lessons learned, but I know there's been a lot of different ideas thrown out, success factors, or I think of them themes or questions. I'll try to do my best to provide some answers or some things that we've learned. But for me, it's been a great kind of experience since basically November, being very much in the weeds with this, working on the development of a proposal for a global environment facility project in these 4 least developed countries, to take a step back and to really try to reflect and pull out some of the lessons learned. It's also strange because it's an ongoing process, so we'll receive some comments back, but I think no worries, Nasir. I think we're doing very well, and we're going to be looking forward to receiving the funds and having approval and moving forward with this project. So, just a quick outline. It's very simple. I'll go through some of the overview of the GEF project and try to give everyone a sense of the process and how we are working with WHO and the 4 countries mainly to develop this proposal. Highlight some of the project outcomes and outputs and highlight some of the activities. So ways that we've had a lot of great discussion already today and yesterday on the impacts that are facing these countries and really thinking through what are our next steps and how are we going to address some of these issues. And finally, briefly kind of highlight some of the lessons learned, success factors, themes, questions, etc. So just to start with geography, the 4 least developed countries in the Pacific region are Solomon Islands, Tuvalu, Kiribati, and Vanuatu. I've highlighted them here, and I really think it's easier to just look at pictures because I think pictures are a little bit more powerful. And I know it's a big topic of debate between Chris and I go on these trips and I never take good pictures because I'm terrible at taking pictures and I usually have to steal pictures. So these are ones I've not taken, but I just like the sense, and this is Solomon Islands and also showing the human aspect. So this is a little girl here in the capital of Honiara. Tuvalu, as Nasir pointed out yesterday, of describing just this width of the country itself and how vulnerable it is. The country, and I like someone said the country itself is vulnerable, not necessarily the people, and I think that was a good point yesterday. But then again, showing some of the people there, and this is Kiribati again, as we've talked about and described, the low-lying atolls and very vulnerable to things like sea level rise. And finally, Vanuatu, this is the capital here in Port Vila, and unfortunately a picture here taken right after TC Pam that came right through that area. So. And I don't want to get too much into the details here because we've had such good overview, but just to highlight some of the 4 areas in these 4 countries where climate change and climate variability is impacting health through these pictures of just. The first is extreme weather events. There's disruptions in the health system, disruptions to health services, and also other systems, water and agriculture, that lead to food insecurities and undernutrition. The other major one is in vector-borne disease, particularly mosquito-borne diseases, dengue, malaria. I think especially Vanuatu and Solomon Islands have had very robust elimination programs, but I think the fear is then with climate change is changing the geographic distribution of the vector, so more chances for outbreak. The third picture there represents waterborne diseases, which is another major issue on all 4 of the countries and will only continue to get worse as the climate changes, and particularly for vulnerable populations like children. And the final one is looking at more longer term and sea level rise and how that is impacting infrastructure, particularly, and other systems, as Jimmy pointed out in his presentation. And I know Nasir showed this yesterday, but this is again from the WHO Climate Change and Health Assessment. And I think it's just a very simple representation of some of the direct and indirect impacts of climate change. And Yeah. And just to pull out some of the examples I've had in my work and my travels to these countries, Jimmy did a great job highlighting some of the issues that Solomon Islands are facing, and this is one that was just really tangible to me when I got to visit. This is a national referral hospital, so the biggest hospital in the country, and it's maybe difficult to see here, but these structures are, there's not much land in between that and water, and they're already facing seasonal flooding. There's some structural damage from earthquakes. It's just a really, really high priority, I think, for the government and moving forward to see how this whole structure, how this hospital is going to get moved. And even Jimmy and I had the opportunity to go see the relocation site on a very, very crazy path up the mountain, one of the more wild rides we've had. And it's just a project that is, at least a decade in the making. So it's really, really difficult to think through some of these things and financially and going through planning of how this is going to happen and trying to do what we can with this Jeff project to try to set some of these things in motion and continue on with some of the assessments and planning needed. Another example, just to highlight the Vanuatu health system. This just kind of demonstrates, we got the opportunity to go visit one of the smaller islands off of the major one fairly close to Port Vila, just to show the difficulty in health service delivery in most of these countries. We had an hour boat ride. We then got on a truck. We went up a road to get to the health center here. And you can see there's some solar there, there's a water tank, but when we were there, none of those things were working. The water tank actually wasn't functional. So the other option there is the closest water source is this little water area that was on a downhill, so anytime it rained, everything's getting washed in there. So even though some of these things, the health centers are on paper maybe set up or they have solar, there's access, they're not functioning. So we already have to look through and be able to assess some of the healthcare facilities. And really both of these just try to highlight that the health systems in all four of these countries are already very weak, and that climate change is just adding pressure to these systems and will only enhance the threats moving forward. So then what's the way forward? What do we do about it? I know most of you have seen this before. It's the WHO framework for building climate resilient health systems. It kind of focuses 10 components around the 6 building blocks here. And I just wanted to pull out a couple or 4 of them that are very relevant for these 4 countries. The first, looking at that we discussed already quite a bit, but integrating the risk and monitoring and early warning systems. So how do we kind of integrate both climate and weather data with health data? The second is, as I already mentioned, some of the technologies and infrastructure, and that's not necessarily just thinking about solar and climate smart health facilities, but also looking at rapid testing kits, stockpiles for medical supplies, for disaster preparedness, especially as Jimmy pointed out too, information and communication technology. These islands are very geographically isolated, so even just simple cellular service or internet service is not likely. So how are you communicating? How are you getting information from there and to there? So it's still major barriers. Again, while we're here, emergency preparedness and management is still something that, again, Jimmy highlighted in some of their plans, but something that needs to be focused for health. And I think probably one of the biggest barriers is the health workforce. So most of the countries are spread very thin when it comes to the healthcare professionals and the capacity of healthcare professionals, and it's a major barrier when you're trying to implement programs moving forward. So how am I doing on time? So now we'll just move to the Jeff project. So just to start out, and really this project and the concept for this proposal really stems from that operational framework of really trying to think through a health system strengthening approach and a whole government approach. So as you can see, the project objective is really to enhance the capacity of national and local health system institutions, personnel, and local communities to manage health risks induced by climate change, variability, and change. So that's a lot. There's a lot. It's a very, I think, ambitious project moving forward, but I think is very exciting too, because it's really trying to hit on a lot of different areas and using kind of all of the systems level approach. So just breaking it down into then the outcomes. The first one, which I'll go into a little bit more detail next, but thinking first at the policy level in the governance and making sure that the policies are in place and that we are integrating and mainstreaming climate risks into health programming and planning and vice versa. So making sure that those are in place, that they can support the technical officers and the people on the ground that have to carry out and implement these interventions. The second one is all around health information systems and how we strengthen surveillance, how do we strengthen those systems, as well as looking into areas where we can integrate climate and weather data to hopefully move forward and develop a climate-informed health early warning system that is useful for decision makers and kind of checks all the boxes that everyone knows about so well. And then the third is focused on health service delivery. So that's really thinking about all aspects. So starting with the health workforce and making sure that they are properly aware of climate risks and trained and have the tools that they need, looking at health facilities themselves, of how those infrastructure can be strengthened there, and also looking down all the way to the community level and making sure that communities are empowered. And then finally, the fourth outcome is really on a regional level between all four countries, but even the Pacific at large, and that's trying to enhance the South-to-South cooperation and fostering more knowledge exchange. So that's really trying to have all four of the countries work together and other countries in the Pacific to work together to have these lessons learned and try to figure out best practices moving forward. So this is just another way to view it, and for each outcome then, part of the job that we focused on is really trying to define and redefine these different outputs for each of the outcomes, working closely with each of the countries to make sure it's contextualized and catered to what they need and what their situation is on the ground there. And then from those outputs are different activities and moving forward. So I'll just kind of briefly, I don't want to go through all of them, but just to highlight some of the things that the project hopes to work on. Starting with the outcome one, which is more the policy level work, it's really trying to first integrate into the relevant institutional mechanisms, policies, plans, and legislation. Second is really looking at the coordination capacity of the Ministry of Health and how that can be strengthened. And thirdly, looking at decision makers within the Ministry of Health and how their awareness can be raised of the climate change and health issues. And different activities include from training these or doing awareness building workshops with the health decision makers to looking through signing MOUs with different institutions to make sure that a technical working group is in place and that there's a coordination mechanism that is, or there's an existing coordination mechanism that we can help strengthen and use. For outcome two, the health information system strengthening is really looking at trying to digitize some of the health records in selected facilities and moving from the paper-based. It's a big job and it is ambitious for most of these countries, but if we're going to move forward and we're going to try to move from just not collecting data to going to analysis and moving towards an early warning system, it's really going to have to be digitized. On top of that, then looking at strengthening the surveillance systems themselves. So as Jimmy mentioned, the Vanuatu and Solomon Islands have fairly strong syndromic surveillance going on. So seeing if there's areas there that we can build off of, as well as using DHIS2 as a platform there that could possibly integrate with weather and climate data and be able to overlay it in a way that it can be simple enough for the decision makers to use. And then finally, the third one is really trying to integrate all this into one early warning system that is tangible for public health decision makers. And Jimmy pointed out one of the highlights of one of the main difficulties is really that coordination between the Ministry of, or the Met Services and Ministry of Health, and how data is shared. And it's really one of the major issues that we went through when we were trying to design this of, okay, where does it sit? Does it sit in the Ministry of Environment and the health data just goes in there, or vice versa? And it's an ongoing, I think, discussion, but hopefully we can continue to move forward. Quickly, just the third one is then hitting on service delivery. Again, looking at some of the infrastructures and some of the high-risk healthcare facilities, as well as strengthening the workforce, and finally moving to the community level. And the fourth is, again, I think a really exciting one, especially seeing all the work that's going on during this workshop and all the different resources available. I think it's very exciting to see that there's, I think, a lot of opportunity to really exchange knowledge and to really learn from one another in the Pacific moving forward. Just quickly, just to highlight, I think Jimmy did a great job of highlighting some of the traditional knowledge that was useful, and I think moving forward with this project, it will be important to really engage communities and make sure that the process is participatory and that they are, and when possible, mixing that local knowledge with health data and climate data. So just quickly again, what does this mean? What were we doing down there? And just to highlight three of the main things that we were focused on is really just trying to establish a baseline, trying to go through a situational analysis and really go through all the policies, everything that's been done before, and give us a good sense of what's moving forward. Again, then looking where are the opportunities of mainstreaming climate change in health planning. And finally, I think the most important is engaging the key stakeholders. So making sure that everybody's in the room and we're targeting the right people to bring into the discussion and really go through in detail of how this is going to work. And for me, that's probably the best part and the most rewarding part is when you're having different groups or different areas in the government that never really talk to each other, and then a light bulb goes off. It's like, well, we're doing very similar work and we should be working together, and seeing those connections happen. This is just a highlight, of course, Jimmy there on the bottom. My colleague Brian Phillips from Vanuatu up in the top left, and Nellie is actually there in the center from Vanuatu, who wasn't here, and Mariah, representing from WHO, meeting with one of the clinic nurses on one of our visits. So very quickly, in 2 minutes, I'll just try to highlight some of the lessons learned. And I made them very brief and very, very compact because I think there's still work to be done, but try to tie a bow on it the best I can. So I think, importantly, we need practical steps for implementation. I think it's been highlighted before, but there's a lot of policies, there's a lot of plans that have been put or have been developed, but then they sit on shelves and nothing actually comes about. And really, as Julie pointed out so well in the morning, that how we just start doing, how do we get that next step from policy and planning to actually implementation. I think there's a lot of assessment fatigue. It's another assessment. We're going to do another assessment. When are we going to actually do an implementation? And I think that's what I heard when I was meeting with stakeholders in these countries. I think building off existing programs, I think this ties in too with the limited resource issues. I think, of course, there's going to be financial constraints, but I think it's also the big one is the human resources. For all these countries, we had such an important core team that was so vital to developing this proposal, but the spread's so thin. If you ask anyone here, they're working 10 jobs, So how do we build off what programs are already there, and how do we scale that up, but also streamline it so that it's part of the work that they're already doing? So I think that's key moving forward. I think coordination, and I think you can insert other C words, collaboration, communication we talk about, but if we really want to have a systems approach, it's going to take coordination, and unfortunately I don't have a clear answer on how that works. I think at the same time we try to come up with technical working groups and different other mechanisms that exist, but I think those also have their own level of fatigue of how many groups can one person sit on, and is anything really going to come of it, what's going to be done. 4 is just trust the process. I think part of the success of this proposal development is how we went about it and the type of ownership and leadership from the countries of really taking hold of and running with these ideas and seeing the areas where they can really find success in. So I think we did a good job of really making sure that all the voices were heard throughout and really creating that foundation that will have success, hopefully have success moving forward through implementation. And the final one is, it's been said before, but to seize opportunities. I think there's certain windows that exist. I think it's exciting to see the action plan come about and the SIDS initiative in the Pacific. I think with GCF and other opportunities, you see a momentum shift, and I think this project especially is a chance to showcase some of the work that can be done in these countries and can be used moving forward. So with that, I just have to acknowledge all the members from each of the countries, as well as the WHO. Without their countless support and all their dedication, it really wouldn't be possible. So I wish they could be here and be talking on behalf, but yeah, thank you so much.